Good morning and welcome to Good Company today.
Over 500,000 hysterectomies are performed each year in the United States. We're going to talk about that today. Women have some options now that they didn't have before, and with us to discuss that is Dr. Jennifer Carroll, who's a gynecologist at Robinson Memorial Hospital. Doctor, thank you very much for coming. Nice to have you here. I wonder if you could describe what a hysterectomy is for those who might not really have the total grasp on its meaning.
Sure. A traditional hysterectomy is basically removing the uterus. Did you want me to go through the procedure?
Yes.
Sure. What we usually do is we make a 4 to 8 inch incision in the lower abdomen, and we remove the uterus as one piece. And typically patients require about a 2 to 3 day stay in the hospital and usually about a 6-week recovery at home. And during that time they need to use a decent amount of pain medicine.
What is the reason for hysterectomies? Why do they have to have it, or why should they have it?
Oh, there's many reasons to need a hysterectomy. Many women have very heavy periods, heavy vaginal bleeding, or possibly chronic pelvic pain, or uterine fibroids, adenomyosis, endometriosis. There's all kinds of reasons. It's a very common procedure.
But it's an invasive surgical procedure, at least traditionally, right?
That's right, yes.
And so you have to recover from that.
Exactly.
But you have new tools available to you these days, don't you?
We do.
Yeah. Talk a little bit about the new approach, the Laparascopic Supracervical Hysterectomy. And I said it right?
You did. That's quite a mouthful, and you need to practice that a few times. The Laparascopic Supracervical Hysterectomy is a minimally invasive technique, a way that we can do the hysterectomy with less pain, less recovery involved. The word laparoscopic refers to using a laparoscope, which is like a telescope or a little camera that goes through a small incision in the belly button, in the umbilicus. And supracervical refers to removing the uterus, the part of the body that's causing the problems, but leaving the cervix behind. And the cervix is actually the part of the uterus that where the pelvic supports come in. By allowing the cervix to remain in place, we retain that pelvic support, and that might actually help prevent future surgeries, things falling down, pelvic prolapse. And also by leaving the cervix in place, that allows us to not disrupt any nerve endings that are in the cervix.
So
and that
the pain is dramatically reduced.
Less pain, and also you may retain some sensitivities, which can be beneficial to the woman also.
Now, in your lab, you have an instrument here. Talk a little bit about that.
I do. This is one of the instruments that we use to do the procedure. Basically, with the laparoscopic supracervical hysterectomy, we make 3 tiny incisions instead of the 1 large incision. And by using the tiny incisions, we're able to use very delicate, very small instruments like this one. We have 1 incision in the umbilicus and then 1 on either side. And using these very delicate instruments, we're able to very carefully dissect the uterus free. And we can also very carefully examine the ovaries and either leave them in place or take them out depending on what the woman's desires are.
So you're literally, you can see what's going on in there.
Exactly. You can see very well.
Yeah. And how long does the procedure take? When
it takes, actually it's a little faster than a traditional hysterectomy, about an hour typically. And the main benefit is that because we're only having very small incisions, the recovery is so much faster. My patients typically go home the next morning, and they're only planning on maybe a week or 2 of recovery at home. In fact, one of my patients ran a 4K race, 5K race 4 weeks after surgery, and she felt great.
Yeah.
Yes.
Let's talk a little bit about Robinson Memorial. How can we reach you and your department?
We do offer this at Robinson Memorial Hospital. This is a very technical, very specialized surgery. It's not offered everywhere. It does require advanced training and also advanced equipment and techniques. And we've been doing this at Robinson since 2008. And
here's a phone number you can call for more information about what Dr. Carroll's been discussing with us here today, 330-297-2893, or go to www.robinsonmemorial.org. Many thanks, Doctor. Thank you very much. Nice to have you here.
Thank you.
Let's go over to Andrea.
What's your dream car? If I told